Oluwakemi, a nurse, pastor, entrepreneur, global speaker, and global leader. A multifaceted individual who embodies a unique blend of compassion, faith, and leadership. She is a proud alumnus of Osun State University, where she studied nursing science. She is a registered nurse by profession, providing quality healthcare and education to individuals and communities. She is a pastor by calling, serving under the leadership of her pastors, Reverend Dotun and Pastor Vincent Arifalo, at the Dominion House Global Church. She has a passion to spread the gospel of Christ and empower men for spiritual growth. She is an entrepreneur, fostering innovative solutions for a better future. She is a global speaker and a global leader, inspiring and equipping individuals worldwide. She has two primary passions: to raise laborers for God's end time harvest. She is committed to spreading the gospel of Christ to all nations and empowering believers. She loves to educate, teach, and train individuals to take charge of their health, unlocking their full potentials for an empowered life and future. She takes interest in health and wellness, spiritual growth and development, leadership and mentorship, entrepreneurship and innovation. She is a Real Madrid die-hard fan. Her mission statement remains to compassionately serve, educate, and empower individuals, communities, and nations spiritually and physically for a brighter, healthier, and more purpose-driven future.
Hi, good evening. Let me know if you can hear me, please. If you can hear me. Hi, good evening, everyone. Good evening, and welcome to Let's Talk About Hepatitis. And I assure you that in today's session, you would learn a lot. So quickly, let me just hear from you. Where are you connected from this evening? Good evening, everyone. I believe you can see me. Hi. So let me know where you're connected from this evening. Just type your name and where you are connected from, or where you are listening to me from this evening. I would love to hear from you. I don't know if I can see the comments coming in. All right. I think it's just me that can't see the comments coming in. Thank you. Good evening. So let me know where you're connected from. Just say your name and where you're connected from. My name is Kemi. I'm connected from Lagos State, and it's so nice to meet and connect with everyone. Thank you, Amanda. I see you. Thank you so much. It's so nice to see everyone and to connect. And tonight, I believe that you would learn a lot. First thing I want to tell you is, because I'm not the one speaking, I'm going to bring up the guest speaker very soon. But I want you to prepare yourself. I believe that as children of God, right, God does not desire that any of his child would be sick. God wants you free. God wants you to be in good health. God wants you to live a healthy life. And living a healthy lifestyle and also living a healthy life is very, very, very possible. So I want you to prepare yourself this evening to learn, unlearn, relearn, and just get ready for an empowering and enlightening session as well as I bring up the guest speaker to speak to speak to everyone tonight. So are you ready? I don't know if it's just me, but I can't see the comments coming in. Are you ready for tonight? You're ready to learn as I bring up the guest speaker. Admin, please help me with the profile. Thank you.
Oshumakide, a Christian medical doctor and a proud graduate of Great Ife Obafemi Awolowo University. He is a practical first aider and a member of the Nigerian Red Cross Society. He is also one of the founding members of the Antimicrobial Club in Obafemi Awolowo University. He is an aspiring public health physician with special interest in adolescent and reproductive health. He is currently practicing as an intern medical doctor at Ahmadu Bello University Teaching Hospital, Zaria. He loves knowledge around history, current affairs, business, and finance. He loves making new friends and having quality conversations with people.
I guess I'm coming up now, right? Because I can't hear you. Good evening. Good evening, everyone. Yes. All right. Thank you. Okay. I can see. Please, can you drop your comment? Good evening, everyone. I'm Oluwatobi Oshomakinde. And yes, it's okay. Thank you. Thank you, Amanda. All right. I'm Oluwatobi Oshomakinde, and yes, it's wonderful to be speaking on this topic tonight, this evening. Please, can the slide come up now? I'm just waiting for them to bring up the slide. In the next, say, 30 to 45 minutes, I will be talking about hepatitis. Actually, the topic was not a full topic on that flyer that was shown. We're actually talking about viral hepatitis. And that is because talking about the word hepatitis as a whole is a broad term. So we're narrowing it down to something that everybody can relate to, something that we can gain from, talking about practical. Okay, thank you very much. So we are bringing it down, making it so practical for everyone to be able to relate with it. Thank you very much, Christina. I can see your comments. It's all right. So without wasting time, I will start right away. All right. Thank you, everyone. Once again, as I said, we'll be talking about viral hepatitis, and that's my name. Yes, I'm currently practicing at ABU Teaching Hospital, Zaria. I would like to start with this quote. While preparing for all of this, for this section, I came across this, and trust me, it looks so beautiful, so interesting, so nice. Interestingly, the quotes didn't have an holder in quotes, where I believe there's another, but we don't know, so an anonymous. The quote says, "We've only got one life, and we've only got one liver, but hepatitis can devastate both." I will start with this, and later on, I guess I will show it again. I will let you. I will show it again. But it's a quote that, yes, we really need to think about. We've only got one life, and we've only got one liver. Hepatitis can devastate both. I will be following this outline just to make the conversation easy. And please, as I'll be talking, you can also do it to note down your questions. Thank you very much. All right, so I'll just go straight. As a way of introduction, when you're talking about viral hepatitis, we are talking about a systemic disease. And the word, it's like bringing two words together. That is why I don't want to. I will try as much as well to use layman terms, to use terms that we can all relate with in this session. However, I still don't want to leave out the meat of the matter. Hepa, it's like hepa then itis. So that's where the word is coming from, and it means liver and inflammation in that order. So the word hepatitis literally means inflammation of the liver. Now, inflammation itself, it's another medical term that I don't want to bore anyone with. But then just know that it's a disease condition that affects the liver. That's the summary. And then talking about the overview, I think if we had to talk about the abnormal, let's know the normal. The liver is not the largest organ in the body. The skin is the largest organ in the body. However, the liver is the largest internal organ in the body that weighs between 1.2 to 1.5 kilogram. The average man in medicine, we talk about the physiological man being a 70 kg man. I'm sure most people that are probably on this call, don't worry, you're not alone. I'm still struggling. I'm still around Perry, 60 thereabouts. So most of us don't weigh 70. Yes, that's the thing. So, but then the liver weighs about 1.2, well, depending on your body weight. But talking about the average physiological man, the average 70 kg man, the liver weighs about 1.2 to 1.7. And then it's a critical organ that is responsible for many functions, that supports metabolism, a lot of functions actually that the liver, that the liver supports: immunity, detoxification, storage, and the rest. I'm going to Okay, sorry. So I'm going to show us in the next slide some function, because I believe, yes, if we'll be talking about liver and we'll be talking about the hepatitis, and then we'll be talking about disease process of the liver, we should know some of those functions. Now, I'll just start from the aspect of the hormone. Liver itself is a production house, and then it doesn't only produce, it also detoxifies. That's why later on in this presentation I'll be talking about the fact that alcohol, the need for cut down and all. Yes, it's very, very important, especially so far with as far as this presentation is concerned. And when you talk about detoxification, especially from alcohol, then from medications generally, virtually all, let me just say, a lot of the medications we use, you know, have something to do with the liver. A lot and a lot of those medications. And then what the liver does is simple. Liver breaks down those toxins in quotes, because there are a number of toxins, so to say, that we also ingest from various sources. Even the medications, so it breaks them down just for the body to be able to absorb them and to be able to make good use of those things. Then also talking about red blood cell decomposition of the red blood cell, cholesterol synthesis. These are substances that are needed by the body, and the body needs those substances to be able to function well. So talk about cholesterol, talk about glycogen storage. Now you can go on fasting for days. Yes, you will not die. Actually, you can go on fasting for up to even 20, 30 days. Just keep drinking water. You will survive, trust me. But something is happening that you don't have understanding of, and that is the fact that your liver has stored a lot for your body to be able to use. So while you're on fasting, while you've not eaten, somebody has not eaten in 20 hours and you say you want to die, you cannot die, trust me. I mean, you have storage. So, and that storage is working. So all the food we are eating, there is a kind of conversion, to glycogen, and then that is also being stored. Protein, also protein storage, iron storage, bile production. We eat fatty meal especially, and then for those to be absorbed, bile needs to be produced, and then liver comes in that place. I mentioned earlier toxin detoxification. Now, a number of times
Simplified.
we use okay, I'm going to talk about how will I put it? Herbal concussion. Yeah, herbal concussion. A number of times we talk about herbal concussion, especially in this part of the world. Let me just say it like, I don't want to say Yoruba. I think it's not only peculiar to the Yoruba setting, because now that I'm here in Zaria, I think it's just Nigeria generally, maybe if not Africa. So those herbal concussion, yes, they might have good substances within them, but also they also contain toxins, and that is also the work of the liver to remove. Then glucose, releasing glucose, just like I said, converting excess glucose to glycogen, then converting glycogen. Please, can this slide come back up? Then converting glycogen that has been stored back to glucose. That is also the work of the liver. And I will be talking about few epidemiology just to make us understand the burden of this condition we are talking about. So again, I says we are narrowing down hepatitis actually to viral hepatitis because that is the one that I know that yes, it's really of public health significance. And after today's session, you should actually be able to go back home and say, okay, I joined this session of Health Talk with Kemi, and this, and this is what I gain, and these are the steps. Because yes, as we go on, I'm going to mention some actionable steps that I believe everybody should actually take note of. Now, this viral hepatitis is the leading cause of liver cancer worldwide. Everybody knows cancer. And then right now we are talking about cancer is, deadly. Yes, viral hepatitis is also deadly. Actually, I don't understand why we don't talk much about this, maybe as much as we talk about HIV. While preparing for this, I was trying to compare which one is actually deadlier, viral hepatitis, hepatitis B, or HIV. Because to some extent, I think we've gone far with HIV, really. And so far, it has not progressed to AIDS. We've really done a number of work with HIV. I mean, people are living with HIV and they're living fine. I mean, literally speaking, we say those until they even tell you, or maybe, as a doctor, you have access to their folder and their medical information. That's actually when you know, oh, this person has HIV. But hepatitis is kind of a silent, killer, very deadly. And then right now, maybe as we go on, you will see hepatitis B is very, very much terrifying. And up till now, there is no cure for hepatitis B. It's that serious. To some extent, we've said, oh, we've gone far with HIV, but right now, hepatitis is still a big thing that globally everybody is still running around for. And globally, I got this information, I think, for this from is it WHO now, Center for Disease Control, estimated number of 254 million people are living with hepatitis B, and 50 million people are living with hepatitis C worldwide. And then every day, about 6,000 people are newly infected with viral hepatitis every single day. And that tells us why we need to take action and why we need to take every detail from this session very serious. Now, an estimated 1.3 million people died from chronic viral hepatitis B and C in 2022. That was just 2 years ago that we are talking about. And what that means is approximately like 3,500 deaths every single day, just from B and C, where maybe A, E, and D, the deaths are not so common as we'll see later. So you understand why we are talking about B and C right in this epidemiology. I'm going to still talk more about the other ones, but then these are the main culprits, especially B, and then see the statistics: 3,500 people every single day. Maybe I should just show you something again, and then you understand the burden of some of these things again. Now look at this. I said globally estimated 254 million people are living with hepatitis B only worldwide. The last census we did in Nigeria, I think right now we are still saying we are 200 million, though maybe I want to believe that we are now more. But imagine the whole population of Nigeria. I mean, you've literally not even counted the people in your own town. I mean, when you enter some market stadium, we're not talking about a whole stadium, we're talking a whole giant of Africa. Imagine the whole number of Nigerians living with just hepatitis B. We've not even added C, we've not added A, we've not added others. That is the burden of this condition. And then currently Nigeria today is estimated at 20 million Nigerians. 20 million, that's literally 10%. I mean, 1 in every 10 persons you meet on the street, in quotes, has either hepatitis B or C. That's how common this thing is right here in Nigeria. 20 million Nigerians, and then we are talking about 200 million population. That's literally 1 in 10 people. That is the statistics right now. But then let's move on to the types. Again, I said there are A, B, C, D up to E. And then I will be dividing this for ease of knowledge. I will not follow it just the way it is right now. I will not follow it chronologically. I will make it easier to understand. Because when you talk about classification based on chronicity, that's why I highlighted that first part. Based on chronicity, there are those hepatitis virus that cause acute infection only. And then there are those that can cause both acute and chronic infection. Now, for those that cause acute infection only, we are talking about an E. Those ones causes acute infection only. Now, when you talk about those that causes chronic infection, we are talking about B, C, and D. So in that order, them this evening. So moving to E. So that's now when you talk about hepatitis A, it's just like I said, it's a cause of acute viral hepatitis only, and then it's most time does not, in fact, it does not progress to chronic hepatitis. To put this CDC, I got this from this. Oh, I think for each of them, I try to put it there. The geographical distribution of hepatitis A virus. Now, even if you don't know the map of the world, a pointer right now. I'm not sure I can use a pointer right now, but I'm not sure if my cursor is visible. At least you can see where Africa is, the map of Africa. I think by now we all know what map of Africa looks like. We are basically Africans. And then you can see where Nigeria is. Look at that red color, this lower part, left lower part of the slide, and see what that red color transpires to. Nigeria is highly dense with hepatitis A virus. That is what we are talking about. The prevalence. When you talk about prevalence in medicine, you talk about the burden of a particular disease. The prevalence of hepatitis A is very, very high. The burden of hepatitis A is very, very high in every part of Nigeria. Actually, most parts. I think that's where in South Africa. That's the blue color, light blue color. Almost every part of Africa, hepatitis A is the prevalence is very, very high, almost in every part of Africa. In fact, virtually all parts of Africa, virtually all. Now, 4 weeks, that's like 28 days thereabouts. Now, what the incubation period means is that you could actually be infected with an hepatitis, you will not show symptoms, and yet you actually have the infection, or one actually have the infection. Let me say you. Let me say you. Now, the incubation period is like, okay, I got a needle prick, and then probably the virus is. But then for 1 week, I will be perfectly healthy, even though the virus was already inside. For 2 weeks, I'll be perfectly healthy. I mean, I'm eating, I'm fine, I'm going about my work, no fever, nothing, at all. You look at me and you'll be like, are you fine? You got a needle prick too? Yes, I got a needle prick, but I'm fine, I'm okay. I mean, that is incubation period. I'm trying to see, there is this, the way Yoruba put it, that something mobile day mokula. Apologies to those that don't understand Yoruba. When your mom tells you that, hey, this is your sin you are committing, don't worry, I will punish you, but I'm covering it for you inside one cooler, I'm piling them up. That is what hepatitis 2 does, and basically that's the idea of incubation period. The virus is gathering momentum, is gathering energy, and then is building. And for 4 weeks, someone is A, and that is this incubation period that we are talking about. And they're talking about the person-to-person transmission. and it's basically through fecal-oral route. The fecal-oral is in the sense that if someone has it, whatever it is, that's why it's not good to always, put hand in your mouth. For those that have bad toilet practices, you don't wash your hand regularly, somebody has put infected hand on railings and then, you didn't wash your hand before you put, after putting your hand on that railing or door or anything, you didn't wash your hand and then you use that hand to eat, or maybe, you eat from infected food, just it goes from the mouth. That's how virus is being got. It's a virus, but yes, it's contracted through this mouth food, or especially if the virus is already there. And then sporadic outbreak also can even occur if one ingests shellfish. I basically add this because this is Nigeria. We also have rivers, Lagos, Delta State, and Port Harcourt, and some of those places, where all these things can be. So ingestion of shellfish that is harvested from especially fecally contaminated waters. All this can cause the transmission of the virus. And then these are just some facts for you to note. It's a viral infection. I basically talk about it. And then number two says it may last several weeks and can be debilitating. Yes, I've not mentioned. Just like I said, it's a cause of acute infection. And basically all the acute hepatitis actually people get to recover completely. I mean, I use the word completely. That's if I will use the word beautiful, but yes, I think that's still the word. Beautiful. It's not all bad news tonight. There are still good news. So I think that's a beautiful thing. People can recover completely from hepatitis A. People can recover completely from hepatitis E. Even hepatitis C. I'm still coming to that, but yes, people can recover from some of this. And then it's preventable by careful hand washing. I mentioned this earlier. Basically all those rules, well, maybe not all of COVID rules, but at least if there's any good thing COVID reminded us of, is always wash our hands. So careful hand washing not only prevents COVID, it prevents a wide range of some other diseases. And key among them is hepatitis A virus. Keeping toilets and bathroom clean, avoiding infected water sources, And then the symptoms, nausea, vomiting, there are actually wide range of symptoms. I will still mention them, And basically, let me just say this too, so that as we are getting there, I might not waste time on it. The symptoms of hepatitis, usually they kind of follow suit. It's hepatitis affecting the liver. So sometimes you can see jaundice, fever, vomiting, nausea, pain, somewhere, you say stomach, but we call it hypochondria. So in your stomach, not your stomach exactly, it's your abdomen. But then your stomach, there could be pain, especially towards the right side. That is where the liver is. So I think you can see this from this screen where that red something. So pain could be there and some other things. So it's usually spread by direct contact, maybe shaking infected hands, and then you just use the hand like that. And then food and beverages, cups and spoons. Basically these are ways it is transmitted. Now, hepatitis E, I'm going to talk about the prevention and, I'm going to talk about them together. The transmission, I will talk about the transmission and prevention together with hepatitis E. Just like I said, A and E, they are cause of acute viral infection, and I just want to group them together. So, hepatitis E also is transmitted fecal-orally, just enterically transmitted. Enterically means that it goes through your mouth to your GIT, and then boom, the virus is gotten. So usually it's primarily in India, Asia, and then I highlight Africa. So Africa too is not spared. Then Central America, and then just like hepatitis A virus, that's the HAV. Along this presentation, I'm talking about HEV, HBV, HCV, HAV, just as abbreviation. So just so you know. So just like hepatitis A virus, it also causes acute infection and also does not progress to chronic infection. For this one, the average incubation period, it has average incubation of about 40 days. That means for the first 40 days, one might not show any symptoms, but then it can range from like 15 to 60 days. That's what we are talking about. And then I added this because I understand that, yes, even in some houses today in the country, people rear pigs, swine basically. And this animals also have been found to be reservoir for this virus. So in situations whereby people rear these animals and maybe you don't get to, or you like eating pig, I think that's even another main point. You like them. I mean, actually pork can be very sweet, can be very delicious really if you get a well prepared one. But then the point lies in the fact that it should be well prepared, because the virus can be there and then such a person can think he's enjoying pork, but then he's also taking in hepatitis E virus. And then this is the geographical distribution. Now look at this interesting map in the sense that it spared almost every part of the world. Yeah, it's affected some parts of Central America and the rest. But then look at Africa. In fact, it's like our immediate neighboring country, maybe except is it Angola now that is towards that area, towards this northeast area. But our whole immediate ones, Togo and the rest, it's actually spare these people. So it's just concentrated on us. So yes, it's very high. That's what we are showing here. Very, very high in Nigeria. It's very, very high. Now, talking about transmission of acute viral hepatitis. Now, this slide is speaking into both A and E. Just take notes. So, close personal contact, just like I've mentioned, shaking of hands, sexual contacts too. Then child daycares. In daycares, I mean, children mix together, they play together, they put hands into each other's mouths, contaminated this and that. So close personal contacts could be a source. Contaminated food and water, infected food handlers, especially some roadside food sellers, and then they just they are not so hygienic with whatever it is they are doing and all of that. So those food handlers also could also be, in quotes, source of infection for other innocent people. If I use the word innocent anyway. So then raw shellfish, just like I mentioned. Then blood exposures. Actually, almost all the hepatitis can be, usually can be transmitted through blood, but then this is quite rare. So blood exposure, injecting drug use, transfusion. Then also people that are at risk, travelers especially. Now you agree with me that if you are a traveler or if you travel often, you are likely to patronize food handlers. That's where that second point is coming, contaminated food and water. And when you patronize food handlers, you don't even know the woman. You don't know how the food is being prepared. So that's how these are linked together. And then homosexuals too, all these this issue of oral sex and different kind of sex, now they are at risk. And then sharing of injectables, sharing of needles, sharing of blade, this thing has affected somebody, as cut through somebody that is infected, and then someone else picks it up to say, oh, I want to use, and maybe accidentally get a cut too. I mean, you've almost always got the virus already. And then talking about the symptoms, just like I said, headache, Malay is talking about just tiredness, fatigue, muscle or joint ache, fever, nausea. Nausea is like, okay, feeling to vomit, but then the vomiting is not coming. And sometimes could actually progress to vomiting. Then diarrhea, loss of appetite, jaundice. Jaundice is usually, you just look at some people's eyes and then you actually see that the whitish part of the eyes is actually yellow. That is the jaundice we are talking about. And then abdominal discomfort, just like I'm having stomach ache, I'm having this, then tenderness, talking about pain. The liver could also be enlarged. Actually, hepatomegaly, I had to change this last year, I had to change English. We are talking about hepatomegaly, lymphadenopathy, and splenomegaly. So liver enlargement, spleen enlargement, lymph node enlargement. All of these could be symptoms. But then now there is a caveat there is a caveat I want to put at this junction, and that is the fact that when you look at all of these signs and symptoms, malaria could present this way. Not only malaria, typhoid could present just this way. And that is where in medicine, we talk about differential diagnosis. That is our whole English. But then I've seen people make mistake. Now, this is where let me share this story, at least from some years of experience and all. This even happened while I was still in medical school. I was in my final year or thereabouts in medical school, I think. There was this man. Interestingly, the man happened to be brother of someone I knew. The death got to me. The man later died. It was hepatitis B. By the time we met the man and then we took over the management, this man, the wife was saying he has been having malaria since last year. It didn't make any sense. But basically, that's how this will start. I mean, look at these symptoms. Sometimes when people come to us and they say, "Oh, I'm having malaria, doctor treats me for malaria." I remember when I first started, the doctor thing, medical practice. And then I remember I once told, we were in one program and then I just joined the medical team. Then I was very fresh, still starting. And then, somebody came and said, I have malaria. It's, people say it's common. And then I just told my chief that, oh, this person has malaria. This and that. My chief said, have you run any tests? Because really, that's just it. I mean, you don't just come and say, oh, I have this, I have that. What if it's something else? This person said, oh, we've been treating him for malaria since last year. Literally last year, we could have caught that hepatitis B early. This man would probably still be alive. Because I'm going to show us the treatment option, at least for this. Yes, we've not exactly won when it comes to hepatitis B, but we've attained some level of success, which I will share tonight. Yes. So all these symptoms could present like malaria. It could present like typhoid. It doesn't mean it's malaria, it doesn't mean it's typhoid. Go to the hospital, let them run tests on you. Let it be hospital, let it be a medical doctor that will tell you, oh, don't worry, relax, it is malaria, so use these malaria drugs. Oh, relax, it's typhoid. Even that typhoid, most people that say they have typhoid is not even typhoid. If you see typhoid, you will know that typhoid is not what you just have like typhoid and malaria are very, very different. So that is just what I want you to note here. That these symptoms can just present like a simple malaria or maybe one severe malaria, but it is not malaria, it is hepatitis. So they basically have the same presentation. And now when we talk about the treatment for acute viral hepatitis, that's hepatitis A and hepatitis E. Sorry. So when we talk about the treatment, usually the treatment is basically symptomatic treatment. It's virus. Virus will resolve on its own. That's just the beautiful thing. Now, usually when people have catarrh, that's why it's difficult to say, okay, take this for your catarrh. Really. When people have catarrh and having runny nose and all, the treatment is basically symptomatic treatment. I mean, it's a viral infection. You just treat the symptoms that it's presenting. That's actually how most viral infection are managed. So if someone is having headache, okay, paracetamol can be given in the hospital or maybe some other medications. If someone is having pain, analgesics can be given. If somebody, just the symptoms that they are presenting with, once we treat it, the viral infection within maybe few weeks, it will run its course and then it will resolve completely. Usually that is for hepatitis A and E. There is no specific like drug that, oh, this drug will cure hepatitis A and then will cure hepatitis B. And also before, lest I forget, there is also vaccine for hepatitis A, at least I'm sure of hepatitis A. But then even in Nigeria, I don't think it's available. I have not come across it. And I was even trying to make findings from some of my own chiefs that are in this unit and they treat this infection. They can't pinpoint that, okay, this, if one of them was saying that I don't think he has actually seen that vaccine. So the vaccine is not so common. Even for A, it's not so common in Nigeria, but then, in developed countries, there's actually vaccine for it. Now, talking about the second aspect of this presentation, based on chronicity, and then I'm talking about those that cause acute and chronic infection, that's B, C, and D. Again, I will say before I proceed, if you have any questions, please note down your questions. Now, for B, it's a DNA virus. Now, this fact that is a DNA virus makes things complicated. What hepatitis B does, actually, in this I should have put something like pathogenesis, all those English, how the virus, cause the infection, but then it's not applicable here. I think we just need to know what to do, how do they present, and what to do when we see something that presents like hepatitis. Basically, that's what this presentation is all about. But this issue of DNA virus, what hepatitis B basically does, It's just that it goes right into our genome. Maybe biology and science students can relate. Art students, no vex, sorry. So it goes straight into the body's genome, and then it integrates itself into that genome, and then it starts using the body. It's like a coup d'etat. Yes, maybe art student can relate at this point. It's like a coup d'etat. Imagine, military man or some people putting forces together and entering Aso Rock, and then they integrate themselves into Aso Rock and then take over from the president and start dictating for the whole country. That is what hepatitis B does to the body. Now, if someone presents early, especially there are some cases that that, especially now, look at a case of probably a health worker or someone that that this person has hepatitis B, and then probably, one way or the other, you got a noodle prick from that person. I mean, something should tell you that, this is, I'm likely to be infected at this point. I mean, this person has hepatitis, and then I just got a needle prick accidentally from the person. In that kind of instance, when that person presents to the hospital, before the HBV integrates itself into that body's genome, we can do something. Treatment can come in. And in fact, at that point, perfect recovery can actually be made. But if someone is delaying and say, let me just watch it or something, that is that delayed presentation that even increase the mortality, the morbidity in this condition. So it's more prevalent in Asia, and also here comes again sub-Saharan Africa. So, and then the route of infection, we talk about parenteral. Parenteral is any route that is not through the mouth. So maybe through the vein, through the sweat, through any body fluid, then sexual contact, and also perinatal. It's actually quite, funny, if that's the word, that mothers who are hepatitis B positive could transfer it to an innocent baby that they just born. I mean, through the placenta, right from the womb, the baby will inherit the hepatitis B. That is another level of, how will I put it now? It's sad, yes, but that is the reality. And for this condition, or for that kind of situation, actually, if those mothers are booked early for antenatal, these are things we screen them for. It's a routine screening. Are they hepatitis B positive or not, and all of that, HIV, all those serologies, we call them serologies. So we screen mothers for all of those things, really. So in that condition, it can actually be treated. Yes, that is actually the beautiful thing. But then the issue comes when people get pregnant, they don't even book for antenatal, or maybe they book and then they don't come for the visits. They are not helping themselves. They are not also helping the baby. And then in low prevalence area like the US and Western Europe, probably primarily through injecting drug use and unprotected sex. That is how they get it. In moderate prevalence areas where it's just like moderate thing, usually through children perinatally, the mother is infected, gives birth to a baby that inherits it in quotes. That's mostly how they get it. In high prevalence, like say China, Africa, all these routes are implicated. The sexual routes, the perinatal routes, the parenteral routes, through blood transfusion. It's sad, but even there are still some quack hospitals. Not when we say present to hospital, I advise go to general hospitals. I think for quite a while now I've been in general hospitals. There are really beautiful private hospitals. I mean, good ones. But most Nigerians can't actually afford those ones. So most time when Nigerians go to private hospitals, you go to most Nigerians go to the substandard ones that can't actually, carry out some of these tests and can't give the right treatment. And that is where the issue comes in. But then to some extent, public or teaching hospital, yes, it might involve stress and all. I mean, quite understandable, but you will actually get the best. So most time when I talk about, okay, go to the hospital, I'm actually talking about go to a teaching hospital, a general hospital. Yes. So all of these routes, because even from some of those small hospital, quack hospital, it's sad, but then people still get transfused. with infected blood, which is sad. In this hospital, in this year, to be very frank, I can't count again how many blood transfusion I have done. And not even by mistake with the lab here make any mistake that, okay, they didn't screen for hepatitis. I mean, before you even get it, you pass through the lab attendants, it will pass through those in the lab, it will pass through the nurse. Once the blood arrives the ward, as a doctor, you have to cross-check with the nurse on duty. So the nurse itself will check again, is this thing screened for hepatitis B, C, and HIV? It's standard procedure. So really, and it's sad that people still now get this kind of infection from so-called hospitals, which should not. So when we are talking about hospital and then we are talking about, okay, go to the hospital, this and that, we're actually talking about, please go to a, sorry, we are talking about go to a public hospital, a teaching hospital. Please just give me control. Don't worry. Yeah. Thank you. So the average incubation for this, now we understand what incubation period is. I mean, period from onset of the from contracting the virus to the first onset of symptoms. So maybe someone gets a needle prick today and then didn't show any symptoms till, I mean, now we are talking about 60 days. Hepatitis B could be that malignant, could be that camouflaging, could be that terrible. So for 60 days, somebody will actually infected and will not show any symptoms. I mean, it can happen. It can go as high as 180 days, but averagely we say 60 to 90 days and can range from 45 to 180 days. Now, this is the geographical distribution of this one. And again, just look at where Nigeria is located. In fact, practically the whole of Africa. And then just the little places that are yellow in Africa is still yellow. I mean, that's intermediate. That is the burden that we are talking about here. So talking about for Nigeria, the prevalence is very, very high in this country. And then these are the symptoms. When you compare with hepatitis A and E, the symptoms we found is basically kind of the same, it's hepatitis. And then these symptoms also, actually, you can see them in malaria. Jaundice can exist in malaria, especially severe malaria, or fever, jaundice, dark urine. I mean, somebody is urinating and sees this Coca-Cola colored urine, nausea, vomiting, pain in the right side of the abdomen, headache, eyes. When you talk about eyes, you talk about skin rashes, joint pain, weakness, fatigue, and losing of appetite. The person just feel like, okay, I don't feel like eating, and the rest of that. And then the transmission also, just like I said, sexually, parenterally, perinatally. And these are the main means where how the virus has been transmitted, especially in high prevalence population. And then just to buttress the point of the mode of transmission of HBV, especially in this part of the world, non-steroid tattoo, those that do tattoo, I mean, this is another caution for the non-steroid dental practices. Contaminated dialysis equipment could also transmit all of this. Contaminated vaccination equipment, non-steroid body piercing equipment, needle, especially those that do, I hope they are not here tonight. But then they know what they give themselves, and then through the vein, and then they inject themselves just to make themselves high and all of that. Sometimes the needle, they keep recycling needles, and then somebody uses the needle to inject himself with those drug, meds and co, or whatever the drug is, and then they give someone else. I mean, it's unbelievable. I'm a doctor and I can't imagine, even sometimes when I've used a needle to give medications to a patient, to the same patient to take samples, say I'm reluctant. I want a new needle, I beg. For the same patient, not to talk of switching needle between two, three different people. It's height of negligence, really. And that is what we find many people doing. Now, talking about prevention, hepatitis B has a vaccine, a beautiful one at that. And this cut across all ages. That is the good news here. For the newborns, at birth, at 6 weeks, 10 weeks, 14 weeks, there is this NPI schedule. That's the National Program for Immunization Schedule in Nigeria. So as newborns, as babies are born, vaccines are being given. It's part of the NPI schedule. So for every newborn, actually that's the improvement we are getting to see. And in quotes, yes, I think it's a big win for us, especially in this country, because now most of these babies that are growing up, they don't have this to worry about anymore. But for probably some of us that grew and didn't get that vaccine, maybe some even got it and can't really remember and all. There is still provision. I got this in I think 2019, the vaccine. And then even this year, earlier this year, I also got here, though I couldn't complete the dose. That was just the issue there. I couldn't complete the dose. But then the vaccine is kind of readily available, especially in centers all around, especially public health centers. You can walk up to the hospital, ask for the information, they'll give you beautiful information about how to get the vaccine. So the vaccine, especially those that are at risk, health workers, or anybody that just actually, even those that want to travel. And why should you not even just get the vaccine? I mean, in some places, it's practically free. When I got the vaccine in 2019, I don't think I paid anything. Here also in Zaria, I didn't pay anything before I say, okay, I just need the vaccine and 3 doses. Get 3 doses in space of I think 1 month interval or 2 month thereabouts. So and then you are good to go. But currently in Nigeria, it is routinely given to every newborn baby. And then there's this hepatitis B immunoglobulin. I was trying to find out the cost of this hepatitis B immunoglobulin, and I think I had to come down to the fact that prevention is still key, and also as you can just get the vaccine. That's the beautiful thing. Though if one is now exposed, as a networker, or maybe you just feel like okay, you have interaction, maybe you've done in Yoruba, they say oti shashe mashe. Sorry, I might be spicing some of this with Yoruba. I know that maybe not everybody are Yoruba. You've not heard the word of your mother as a female child, or you've not heed to the advice of your father as a male child or whatever, and then you've done what you should not have done, in terms of sexual whatever, and then you are afraid that okay, this could be a thing. Maybe one way or the other, you get in that okay, this person could actually be infected with hepatitis and the rest. Hepatitis B immunoglobulin is very effective in that kind of situation. Maybe as a networker that got a noodle prick and all of that. But it's very effective within the first 48 hours. If I'm right, I think one of my colleagues here had reason to get this. I couldn't reach her before this presentation. I've gotten the raw data, from her. And the immunoglobulin, I was asking somebody yesterday, and I think currently the price is around 150 to 170,000 naira. This hepatitis B immunoglobulin. So it can be this one is actually very expensive. But then if one is exposed, I promise you this price is very cheap compared to the effect, the cost of treatment, and then whatever sequel. I'm still going to talk about the treatment later on, because I can't imagine spending this one now. You are literally going to the extent of spending 30,000 naira every single month for life. If one actually get this infection and it has reached the chronic stage, that is hepatitis B, really. So it can be very, very deadly. But then other methods of prevention include screening of blood donors, body fluid, and the rest of them. Then now one to is that treatment? Yes, treatment. That's why I didn't exactly say treatment or treatment option. I would say yes, treatment is available. Now, actually say no, it is not available. Now, treatment for chronic hepatitis B is lifelong. I mean, as long as especially once it reaches the chronic stage, then the person has to be on treatment for life. And I was asking one of my senior registrars that is actually in infectious, okay, that is in internal medicine, and get to treat some of these get to have a number of patients with this condition. And then he was trying to say that I think the current cost of the drug now being used is around 30,000, and the drug is used every day, but then the 30,000 naira 30,000 naira drug covers 1 month. And That's literally 1,000 naira every single day for the rest of one lives. That is if that drug remains at that is if that drug remains at 30,000 naira. And that is just one of many other treatments. I mean, you collect card, you run tests because test has to be run, serially to know, okay, now what is the viral load that we are dealing with? How is the virus responding? And now the treatment is not, that's why the third point now I said, however, it is not curable. So no, there's no treatment. Yes, actually, no, there is no treatment. And yes, there is treatment. So the treatment is what I was trying to explain. And then the part of no treatment is in the sense that if the virus has already, before we can talk about chronic stage, maybe it has damaged up to like 50% of the liver already or thereabouts. And at that point, you can only slow down or maybe halt the process. If the person adheres strictly, maybe you can really slow down the process of damage to the liver, that it will look like you've actually stopped the process. But then the damage being done initially cannot be reversed, and then more damage can still be subtly done, especially if the virus has really gone deep, deep into the body system. So early presentation to the hospital at the earliest sign of symptoms can increase the prognosis and can also increase the chance of survival. Now, I want to talk about some actionable steps that I think everyone should do and should know about. If there's anything you want to note down from this session, is that at least after now, just walk up to hospital or a clinic. Just tell them, I want to know my hepatitis B status. Where now there are caveats because when we want to actually determine hepatitis B, just like I said, don't forget, we talk about incubation period. So it could actually be present, but then there might not be symptoms and all of that. So sometimes maybe the SAG, there is HBsAg, HBCAg, HBeAg, that is for the medics. But then at least it's just good to even know about the status and then just be aware. And then if negative, please get vaccinated. If positive, see a physician and in fact, preferably a gastroenterologist. Those are the GIT doctors and those are the ones that can handle. So see a specialist really. And then as much as possible, follow the treatment algorithm, even if you feel healthy. I think now we've talked about this. And also it's important to educate. I mean, a number of our family members are not here tonight or are not here on this in this session. It's important to tell them about this virus and then what they should be aware of. So I will talk about hepatitis D very briefly. Hepatitis D actually is a kind of defective and it cannot occur on its own except in the presence of hepatitis B. That's how I'm putting them together. So it cannot just propagate on its own in the absence of another virus, and usually B and D goes together. Now, when someone acquire hepatitis B and D at the same time, we call it co-infection. And then sometimes the person might have acquired B and then still didn't know his limits and still continue with risky sexual behavior usually, because that's like one of the main ways. And then still now acquire D on top of the B. Then in that case, we say super infection. So that's just the difference. And then looking at the geographical location, I think it's only this one that I can say, yeah, the prevalence is like intermediate in Nigeria. Personally, I've not seen one in the last 1 year. But for hepatitis C, I think I've seen one and I've heard of one too. Hepatitis C2 is not that, okay, I've heard of two, but I've seen one. So that's like three thereabouts, at least in the past few months. Because interestingly, I received a call like 3 weeks ago, of someone that had hepatitis C and then they were trying to seek information and all of that. So for this one in Nigeria, there's just this intermediate prevalence, well, due to our data too, they really couldn't tell, but then it's not as rampant as A and a B in Nigeria. And then just like I said, the transmission percutaneously, usually through intravenous drug use or unhealthy use of a syringe and needle and the rest, then sexual contact. And then the prevention in HB, just like I said, HDV, that's hepatitis D virus, cannot occur alone. So it occurs, it's usually like with hepatitis B virus or a kind of super infection. So usually treatment for hepatitis B actually covers for this because when one is vaccinated and then immune against hepatitis B, then I mean D cannot thrive. That's basically what we are saying. So pre and post exposure prophylaxis to even prevent hepatitis B virus infection goes a long way to also prevent hepatitis D infection. And also for the super infection, education also to reduce risk behaviors among persons with chronic hepatitis B is also key. Just like we are doing tonight, at least everybody is getting to know that, oh, this and this is what I'm supposed to do. And now for hepatitis C, this is the last one I'll be talking about. It's also a cause of acute and chronic hepatitis, just in similar manner as HBV, and is transmitted parenterally. I think now I've explained what parenterally is, not orally, not through the mouth. So maybe through vein or through sex or other means, blood transfusion and the rest. And worldwide, about 50 million people are living with hepatitis C, and the prevalence currently in Nigeria is actually unknown. That is the color you are seeing on the screen. There is no exact data for us to say, okay, this is the prevalence of this in Nigeria. And the transmission is usually through transfusion or transplants from an infected donor. All these where hospitals should actually have, hospitals actually should have, what would I call it, protocols to curb all of this. So this, in the real sense, is not the person's fault. I mean, why should I get an infection just because I came to receive transfusion? So there are protocols actually put in place in standard hospitals. That's why I'm still trying to caution against anyhow hospital. That people go to in the name of, okay, no money, and then I just need to go to an hospital. No, sometimes beyond just going to an hospital is going to the right kind of hospital. Then injecting drug use, hemodialysis, just like I said, especially with infected machines and the rest. Then accidental injuries with needles, shafts, and also multiple sexual partners. These are ways by which it can be transferred. And the majority of people with HCV actually develop chronic hepatitis, up to 70 to 90% of them. And then the incubation period is average of 6 to 7 weeks and can range from 2 to actually 22 weeks. And then for this, there is no vaccine for it. However, the interesting thing is it can be cured. Unlike hepatitis B, usually for hepatitis C, the treatment just range for like 3 months, really, when it's not so complicated. And yes, the person can actually be cured for hepatitis C, but then there's no vaccine for it. And then the prevention, also screening of blood, before donating organ and or organ tissue donors, then high risk behavioral modification, blood, body fluid, precaution, all of this are what should be taken note of. I want to say that is the end of my presentation, but then I'll just give a very quick recap for us to have overview of everything that we've talked about. I guess this slide will be shared, so I won't exactly dwell too much on some of them. But then this is just like summary, source of the virus. For A, we are talking about feces. For B, we are talking about blood or body fluid, blood derived and the rest. A, E also feces, just summary. And then the one that can develop to chronic infections, B, C, D. That's yes, yes, yes. And then other few details. But this next slide is actually where I think I want us to focus on. And hopefully when you get this presentation slide, just take time, study this. I guess this can help in no small ways. Talk about incubation period, talk about the signs and symptoms, talk about prevention, the one that has vaccine, the one that does not have vaccine, and then the treatment, supportive care, antiviral, and the rest. And then now there are other factors that can potentiate the effects of viral hepatitis. And that is in the sense that because you'll be amazed that actually some it's not really everyone that have hepatitis that we know almost always come down with severe symptoms. It depends on how your body is. If you are very healthy, say you are a fruit lover, and then your immunity is very strong and all of that, your body can actually clear some of these infections just with minimal drugs, especially if medications comes into play and then they aid your body, and before you know it, your body clears it, you are very fine. But then in people that takes alcohol, that becomes an issue, because in those that take alcohol, the alcohol is also damaging their liver. The hepatitis is also damaging the liver, and that becomes an issue. So the liver is even trying hard to fight against hepatitis, and then this person is also not even helping the liver, and then you are giving the liver more work by taking more alcohol. Now, in taking more alcohol, the liver has to work on that alcohol. Don't forget the function of liver detoxification and the rest. The liver really has to work on alcohol and break it down. And then in that case, the liver can be overwhelmed. Alcohol itself, there is alcoholic fatty liver disease. So alcohol itself is actually a cause of liver disease, then hepatitis, and then when both combine, it can potentiate the effects of this viral hepatitis and can make the symptoms really, really severe. Obesity is another issue. When we talk about obesity, we talk about, in fact, a lot of issues coming down with obesity, fatty liver and the rest. Obesity itself has this way of accumulating fat on the liver. And then when those fats, liver is working on those ones, and then hepatitis, just like in the same way also with alcohol. So obesity also has a bad prognosis in quotes. And then drug abuse or drug overdose. Some people, it can just be as a result of even PCM or other common medications. That's why I put overdose. Because if I say drug abuse, I know people might be thinking cocaine. Yes, maybe, amphetamine or whatever those drug is that people abuse, that they are known to abuse. But then drug overdose also. When your doctor says use this drug for 3 days, in fact use one, sometimes the drug can be so tiny, and then you're like, I'm having this illness and you're telling me to use this tiny drug, one in a whole day, not even 2, 3 times daily. Yes, use that one in that one day, please. That is what we are talking about. Because I think this drug loratadine is a good example of something like that. The first time I handled loratadine, it was very, very small, 10 milligrams. That was very small. Interestingly, I had reason to prescribe it for someone, I think 3 weeks ago or 2 weeks ago. And I had to hammer it to this person, please use one and use it at night when you want to sleep. Because if you go above, you will just be dozing all through the day, and then you can get yourself useless. So if they say use one, please use one. And one, is it once in a whole day or just one in the morning, one in the afternoon? So follow your doctor's prescription. Very, very important. Because everything is coming back to the liver. The liver has to work on almost all the drugs. Just few drugs do not get metabolized by the liver. Just few. Majority of the drug that we use as humans get to the liver first, and then the liver has to work on them. So drug overdose can also affect this. Then diabetic mellitus is another thing. People living with diabetes are basically immunocompromised people. And then in this age range, in this set of people, their immunity has already gone down. So in this case now, hepatitis is coming in. The body's own soldier, that is what we refer to as immunity, that should fight the infection. They are already weak, because that's what hepatitis does. It weakens the body soldier to fight any infection. So in that case, they can also, come down with serious condition, serious symptoms of viral hepatitis. And then some people, they just use steroids, long-term steroids use for one or two reasons. Some people just be on dexamethasone or just, be on prednisolone, and you are wondering why. No doctor will prescribe that for you. But sometimes they can say it improves my symptoms, it does this. Please, in fact, steroid use generally lowers your immunity and can cause wide range of infection for you, and also hepatitis is one of those infection. And now this is a take home that I think everybody should be aware of. Please get tested, and if negative, congratulations to you, get vaccinated. If positive, get treatment. This is like the second or third or fifth time I'm mentioning this. And then as much as possible, yes, we are young and all of that, but then avoid risky sexual behavior. Maybe I'm a pastor, I'm not meant to say this, but at the extreme, use protection. But then avoid risky sexual behaviors. Avoid alcoholic drinks too. I mean, we've seen the effects, we've seen what it can cause. Go to hospital early also if you suspect any symptoms, or you think you might have been infected, probably because of one or two things you've done or needle prick or anything. Inform those that are close to you also, even if you are infected. Don't let it be like, I will not go down alone. Please, that's a devilish thought. Only if you know the cost to treat one person living with hepatitis, then you know that you shouldn't just get it to another family member. Let them know at least these are your family, these are people with you. There is no shame. And please, yes, stop the stigma. Even if you know someone, just encourage them to get treatment. That is what we are advocating for. And then, sorry, in conclusion, I would say viral hepatitis is a disease of the liver that is caused by a virus. I mentioned that earlier. And then untreated ones, especially hepatitis B and C, can actually lead to serious liver problems. It can lead to liver cirrhosis and can also cause liver cancer. Don't forget where we started from, that viral hepatitis is the leading cause of liver cancer worldwide, in the whole world. And even when there are no symptoms, one can actually still spread hepatitis. Even, that's when we talk about period of incubation period. So one can actually still spread the infection even when that person is not actively, showing any symptoms. And also, getting tested is the only way to actually know that you have or you don't have viral hepatitis. So it's important to get tested. And then vaccines can prevent hepatitis A and hepatitis B. And then medications can actually cure hepatitis C. And then I will end with this again, just where I started from. At least now that we've heard all of these stories, we've got only one life and we've got only one liver. But hepatitis can actually devastate both. Thank you everyone for your attention. I think I will entertain questions now. Now, so I'm laying over to you.
All right, thank you so much. Thank you, Dr. Oshimakinde. That was an enlightening session. I personally learned a lot as well. Please, if you have questions for Dr. Oshimakinde, please drop the questions in the comment section so he can pick it up and respond to every of your questions as well. Please say thank you to Dr. Oshimakinde. Thank you for your time. Thank you for being here with us tonight. Thank you for teaching us, because you taught us, you taught us a lot. And I think not everyone was aware about the types of hepatitis and how to prevent them, how to, the vaccine and everything. Thank you so much. We celebrate you. And you will get the slide as well. For everyone that registered with the link, the slide will be sent to your email as well, so you can look forward to having the slide. Thank you so much once again. Admin, please bring up the video. Thank you.
Me, your reliable source for health information and expert advice. A health talk channel dedicated to providing accurate, evidence-based information on various topics, from nutrition and fitness to mental health and self-care, and all other medical conditions. We've got you covered. Be a part of Health Talk with Kemi as we explore the latest health trends, discuss common concerns, and empower you to take control of your well-being. Join our community to stay informed, inspired, and motivated. Healthy Living Simplified. Welcome to Health Talk with Kemi, your reliable source for health information and expert advice. A Health Talk channel dedicated to providing accurate, evidence-based information on various topics, from nutrition and fitness to mental health and self-care, and all other medical conditions. We've got you covered. Be a part of Health Talk with Kemi as we explore the latest health trends, discuss common concerns, and empower you to take control of your well-being. Join our community to stay informed, inspired, and motivated to achieve your health goals. Stay empowered, stay healthy. Health Talk with Kemi.
Thank you so much. Thank you everyone for joining in today. Thank you for joining our first ever live session, and get ready for more. We are going to be having more of these live session. Get ready for more in the month of November, month of December, and every other month. And please do not forget to subscribe to our YouTube channel to get notified whenever we post a new video as well. Thank you for joining me tonight, and we hope to see you again some other day. Please share what you learned with us in on our various social media platforms. I think the links are being posted. Please share what you learned with us as well, and let's connect together. Love you, and thank you for joining Health Talk with Kemi. Have an amazing night rest. Good night. Mwah.